Hello, welcome everyone. I'm Dr. Mugdha Raut, a gynecologist and a clinical reproductive immunologist, and the co founder of Dr. Raut Center for Reproductive Immunology, which is India's only dedicated center focused on immune related causes of infertility, pregnancy loss or miscarriages, and IVF failures. We at Dr. Raut Center for Reproductive Immunology treat couples with unexplained repeated pregnancy loss, unexplained IVF failures, and unexplained infertility with the active immunomodulation, that is ImmuLIT, which is our patented and branded process, and other passive individualized reproductive immunomodulatory treatments. We have our centers in Mumbai and many other cities in India. If you've been through multiple miscarriages or IVF failures, or have been told everything looks normal, yet you're still not pregnant, you're in the right place. Because today, we're addressing a question that breaks my heart every time I hear it. Why were we not told about ImmuLIT before? Let's explore the real reasons behind this. And more importantly, what you can do about it. And by the end of this talk, I hope you'll have clarity, not just answers, but hope. And as I said, more importantly, what you can do about it. Now let's break that question. Why was I not told about ImmuLIT before? Let's break it down into three main reasons you are hearing about ImmuLIT late. The first reason is your family or relatives may be unaware. Most of us first turn to family and friends when something doesn't work. But even the most caring people might not know this field exists. They'll say, try another clinic, try a different IVF protocol, have faith. But they will never ask, have you checked your immune system? Because they simply haven't heard of reproductive immunology. The second reason is you think it is normal. Many couples begin to normalize repeated loss. They are told it happens, you're still young, give it time. Try another round. And so you start to believe maybe it's just me, but it's not. At some point, we have to stop calling it bad luck and start asking why this is happening. And the third reason is your doctor may not be aware. Now, this part is sensitive but important. Your gynecologist or IVF doctor may have done everything by the book. They are well trained, they care. But reproductive immunology is a super specialty. It's not a part of standard fertility training yet. Even if they have seen cases of unexplained pregnancy loss or IVF failure, they may not have had the time to deep dive into reproductive immunology. Because let's be honest, a doctor's day is packed with surgeries, emergencies, and patient rounds. Unless they follow global research or attend conferences where we speak, they may not know when and how to refer. And that's why you are hearing about ImmuLIT now. Let me tell you what patients tell us every day in their own words. Many of the patients tell us, Doctor, I'm just not convinced that something so effective, something that's done in one sitting, could be so unknown. Why didn't my doctor mention this? Why didn't I see this on Instagram or Google? They are shocked, especially when they learn for the first time that the use of blood and not gametes is directly involved in fertility treatment through ImmuLIT, something they have never been told before. They often say, if this is a 1 day, 3 hour visit to Dr. Raut's Center for Reproductive Immunology, if all other steps can be done online with the help of our doctor in our city, why don't more people hear about this? And you know what? They are right to ask. Because we hear this every day. Let me pause here and share with you a real story. A real case of miscarriages, 5 miscarriages despite perfect embryos. She was 35, married for 6 years. They had done 5 IVF cycles. All resulted in pregnancies and ended in miscarriage. Her reports were normal. Embryos excellent. Doctors said it was just unexplained. When she came to us, we looked deeper. We found signs of alloimmune rejection, which her body unknowingly was rejecting the embryo. We did ImmuLIT, which is our patented active immunotherapy using partner or donor lymphocytes. We also added passive immune support medications. She conceived again in the next IVF cycle. This time, twins, which went to a full-term pregnancy. She delivered 2 healthy baby boys. That's the power of immune diagnosis and targeted immune modulation. Her words after birth I can never forget. I can't believe something this life-changing wasn't even mentioned before. So let's see why ImmuLIT is gaining popularity. And the truth is, many of our patients have taken it upon themselves to spread the word. Some write long reviews with their baby picture. Some tell their gynecologist to read about it. Some refer their cousins from Jaipur, Chennai, or abroad because the process is so simplified. With our online consultations, blood tests done in their cities from standardized laboratories. ImmuLIT, the way we do it, is done only once over 3 hours, no fasting, no anesthesia, no repeat blood tests. And a few doctors, the ones open to innovation, are now informing their patients about reproductive immunology even at general OBGYN visits. So now let's see what's the difference between conventional and immunological approach. Let's make a quick comparison. A conventional approach focuses on hormones, embryo, sperm, uterus, and other factors. An immunological approach focuses on immune environment. A conventional approach focuses on repeat cycles. An immunological approach focuses on investigating the immune rejection. When a conventional approach focuses, hope it works. Immunological approach focuses on personalizing immune response. A conventional approach focuses on unexplained. Immunological approach focuses on finding the explanation. And mind you, we are not replacing IVF. We complement it with science, precision, and results. Now let's bust some myths. First myth is this is experimental. No, ImmuLIT is based on over 30 years of research practiced globally. We've refined it in India with remarkable results. The second myth is it only for women with autoimmune disease? Not at all. Most of our patients have normal autoimmune tests. The issue is alloimmunity, something standard blood tests don't catch. The third myth is this an alternative to IVF? No, this is not an alternative. It often works best alongside IVF, especially when IVF has failed despite good embryos. Now, my final thoughts are if you've been told try again, everything looks fine, just wait, ask yourself, could there be something deeper? Could it be your immune system? At Dr. Raut's Center for Reproductive Immunology, we've helped nearly 4,000 couples with ImmuLIT. Many of them came to us as their last resort. Today, they call us with happy cries and baby photos. Now, how can you act? Let's spread the awareness together. Tag someone who needs to hear this. If you are a patient, direct message us. We'll guide you. No pressure, just science. If you're a doctor and have cases that puzzle you, refer them. Let's partner together for your patient's success. Let's bring clarity to unexplained because everyone deserves answers. And now you've heard about ImmuLIT and you'll never have to ask, why didn't anyone tell me again? Thank you for watching. Do share this live with at least one person who think will benefit from the treatment. Knowingly or unknowingly, you may change the life of one couple. You can contact us on our number +91 9833201522 or visit us on www.icprm.in. Thank you. End recording करो.